Pharmacies. Now, here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Farm Center. I'm your pharmacist, Paul Watt. We're double dipping here. Okay. Am I to go?
Yeah, go ahead.
Okay. We're glad you joined us. Before we begin, I'd like to thank our sponsor, Altman Health System. Today, pharmacist Brad White and I are broadcasting from our administrative offices, and our special guest is Dr. Haider Taii. Good morning, doctor, and welcome to the show.
Good morning, Paul. Thank you for having me.
All right. Well, good morning. We'd like to remind our listeners today that our program is available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe to our program.
Good morning again, Dr. Taii. Tell us a little bit about yourself and your career.
Good morning again. I'm board-certified cardiologist with advanced training in cardiac electrophysiology, which focuses on heart rhythm disorders. I currently practice at Altman Health System, where I care for patients with both common and complex heart rhythm problems, using medications, catheter ablation, and implantable devices.
So, what is your specialty within cardiology?
So my specialty is kind of subspecialized field within cardiology. We focus mainly on diagnosing and treating abnormal heart rhythms, such as atrial fibrillation, ventricular tachycardia, and slow heart rhythms that may require pacemakers.
Pacemakers. What is the difference between general cardiology and electrophysiology?
General cardiologists manage a broad range of heart diseases such as coronary artery diseases or heart failure. Electrophysiologists focus mainly on heart's electrical system and rhythm disorders.
All right. So let's get into the meat of it, doctor. Can you talk about what is atrial fibrillation, aka AFib?
Atrial fibrillation is irregular and rapid heart rhythm that starts in the upper chambers of the heart. It can lead to poor blood flow and increase the risk of stroke. And
Okay, can you get...
Yeah, go ahead. So signs and symptoms of AFib sometimes include palpitation, sometimes shortness of breath, fatigue, which is very common symptom, dizziness, chest discomfort, or decrease in exercise tolerance. Some patients may notice no symptoms at all.
When is it appropriate to go to the ER if someone thinks they have AFib?
So I usually tell the patients in the clinic, you should seek emergency care if you have any of these symptoms, such as chest pain or chest tightness or fainting spells or severe shortness of breath or symptoms of stroke, such as speech difficulty, weakness in one side of the body more than the other, or facial drooping. So all these signs, all these symptoms, the patient should seek emergency care.
Why is AFib a big deal?
I think the AFib is a big deal because it's increased the risk of stroke and also can cause heart failure. Early diagnosis and appropriate treatment will definitely reduce the risk of stroke and reduce the admission to the hospital with heart failure symptoms.
And so why is a blood thinner so important?
Blood thinner is so important to reduce the risk of stroke for those patients by preventing clot formation inside the heart that can dislodge and can lead to stroke. And sometimes these medications are actually life-saving.
So what happens if someone cannot tolerate a blood thinner? For example, if they have had a history of bleeding, anemia, or frequent falls?
So this is a very good question. Patients who cannot tolerate blood thinners, there are alternative these days. It's a procedure, but it can also save patients' life if they have high risk of stroke and they have high risk of bleeding, obviously. We use left atrial appendage closure devices, then we can implant, and that can be an alternative for blood thinners for those patients who have high risk of bleeding.
So is AFib life-threatening?
AFib itself, usually not immediately life-threatening, but its complications, for example, the stroke and the heart failure, can be very serious. That's why long-term management is needed for those patients.
So what are some of the common conditions that may coexist and could aggravate AFib?
That's a very good question. So the first thing when I see patients with AFib, I ask them a few questions about their blood pressure, about their diabetes, if they have diabetes. Obesity is very important risk factor, and obstructive sleep apnea. So if patient has obstructive sleep apnea and they don't treat the sleep apnea with CPAP machine, they are at very high risk of having rhythm disorders such as atrial fibrillation. Some patients, they have triggers for AFib such as excessive alcohol intake. Some patients might have thyroid disorder. Hyperthyroidism, overactive thyroid gland, can lead also to AFib. Treating these conditions is very important. So when patients refer, for example, for AFib ablation, I also manage the other comorbidities and always advise the patient. Important taking care of weight, lifestyle modification, which including weight reduction, 10 to 15% of body weight. Also, I emphasize on treating sleep apnea, and I advise them to use their CPAP machine.
Gee. So, Doctor, what are some lifestyle modifications that can incorporate to help prevent AFib?
That's a very important question. Maintaining healthy weight, exercising regularly and daily, at least 30-minute exercise per day. Doesn't have to be weightlifting, such as fast-paced walking. Limiting the trigger, such as limiting alcohol intake. Managing stress, treating sleep apnea, controlling blood pressure and controlling blood sugar, all play a major role in preventing or reducing the burden of the atrial fibrillation.
And the reason
Because, yeah,
it is so important to take medication exactly as prescribed when you have an AFib.
it's very important to take these medications to maintain sinus rhythm and avoid flipping between AFib and sinus rhythm. The stroke most of the time happens when there is conversion between AFib and sinus rhythm. The problem with AFib, the blood flow gets impacted, and when it becomes slow, clot can happen. As you know, medications have a half-life. So we tell the patient to take the medications on time to avoid missing any dose so that medicine level remain therapeutic in the system and avoid having bad consequences such as stroke.
Wow. There's so many good medications out there these days compared to years ago. Um, are there certain category medications that you do prescribe in an AFib case?
Yeah, so I prescribe blood thinners. I prescribe always, if patients have symptoms, also antiarrhythmic medications. We have many options. We usually tailor the prescription based on the patient's characteristics, such as, for example, let's say we prescribe antiarrhythmic medication. We first look at the kidney function. Some of these medications are renally cleared. So it's important to check the renal function for the patient. Some of these medications can have impact on the thyroid function or liver function. So we follow up on the thyroid function, liver function as well. That's for the, obviously, the antiarrhythmic medications. For blood thinners, we usually also see what the patient has. Let's say if the patient had prior history of coronary artery disease, do they have stents? Do they have to take antiplatelet beside the anticoagulant therapies? So all these factors we look into before we make the decision and prescribing the medication.
There are newer products other than Coumadins and stuff like that.
Yes, yeah.
And they are being used more frequently, I think. So,
Correct.
Is that the case? I know
yes, because Coumadin, Coumadin is a good medication, but it requires frequent follow-up with the therapeutic range with the INR. The newer medications, the patient, they don't have to have lab test. They don't have to follow on the therapeutic range by doing lab test every week or every couple weeks.
Okay.
Do you have any comments for patients, doctor, that kind of give you, sometimes we get pushback because people get frustrated because there's so many medications. And when you're dealing with complex heart situations like you are, they're going to probably be taking 2 and 3, maybe 4 different medications. How do you try to approach questions and resistance for people being compliant on their medication to keep their heart as healthy as they can in those situations?
Yeah, I usually tell the patient, obviously we give recommendations, but we advise them to take these medications because we don't want them to have a bad outcome and they end up in the hospital. And I tell the patient, if you don't want to take a bunch of medications or long list of medications, we should work on lifestyle modification. Sometimes when we manage weight and treat sleep apnea, we lower the dose of blood pressure medications, or sometimes patients get off the medication. For young patients, early diagnosed AFib, and they have low risk of stroke because they are young and they don't have, for example, diabetes, or they don't have hypertension. I tell them, if you exercise, try to lose some weight, pay attention to your diet, you will not require lifelong anticoagulation therapy. So you can get off the anticoagulants and you can get off the antiarrhythmic medications by just fixing a few things, especially in the course of the disease.
Well, doctor, I guess it's time for our first break. Okay. You are listening to Health Matters with the Medicine Center Pharmacy.
Are you tired of paying hundreds of dollars to find out your thyroid, A1C, cholesterol, and vitamin levels? You don't have to anymore. Schedule your low-cost lab test at the Medicine Center Pharmacy. You can get your A1C, thyroid, and vitamin D lipid profile, which includes your cholesterol levels as well as glucose results. Test results in just minutes, and you can share them with your provider. Call the pharmacy or schedule online at MedShopRx.com. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Out By store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy.
The Medicine Center Pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia.
This is Paul White from the Medicine Center Pharmacy. We have a fantastic deal for you just in time for flu season. Pick any 2 Quality Choice brand cough and cold items and get 50% off the lower priced item. Also, at the Half Off and Hot Buy store, we are all set for Valentine's and Easter. We're thinking ahead for warmer weather, so stop in and take advantage of these great deals here at the Medicine Center Pharmacies and the Half Off and Not Buy store.
Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, midshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
1480 WHBC.
Welcome back to Health Matters with the Medicine Center Pharmacy. Are you ready for vaccine season? Stop in or schedule your pneumonia, Tdap, or shingles vaccine online at midshoprx.com.
All right, doctor, let's switch gears a little bit. Let's talk about ventricular tachycardia, aka VT.
Yeah. So ventricular tachycardia is a fast heart rhythm that starts in the lower chambers of the heart compared to AFib start in the upper chambers. It can interfere with the heart ability to pump blood effectively. This type of rhythm can be fatal. And this is one of the emergencies that we have to take care of when the patient arrives to the hospital after having an episode of ventricular tachycardia.
So how does VT differ from AFib?
So AFib originates in the upper chamber and the atria. Ventricular tachycardia originates in the lower chambers, in the ventricle, whether the right or the left ventricle. Atrial fibrillation usually not immediately fatal. With ventricular tachycardia, the rhythm can lead to dangerous outcome, can lead to cardiac arrest.
Interesting.
So why, I guess you've already said why it's dangerous. What do we need to look out for VT?
So the first thing, obviously, like loss of consciousness or like episodes of palpitation that can associate with dizziness. Because in the beginning, these episodes can be short runs of ventricular tachycardia, not sustained or long runs of ventricular tachycardia. So any episodes of palpitation that associated with dizziness or feeling about to faint, about to pass out, or even loss of consciousness, severe drop in blood pressure, all these symptoms patients should pay attention to because that means probably they have episode of ventricular tachycardia.
Why? We probably answered this, why it is dangerous. What are some common causes of VT?
So that's a very good question. There are many causes of ventricular tachycardia, and there are different mechanisms of ventricular tachycardia. So, like most commonly, VT occurs in patients with a prior heart attacks. When there is a blockage in an artery that can lead to muscle death, this muscle or this scar that had basically had no blood flow from prior heart attack can sometimes become a substrate for a re-entry mechanism, ventricular tachycardia. Some patients, they have normal coronary arteries and they have still scar from different reasons, such as a prior viral infection, myocarditis, or sometimes they have infiltrative diseases such as cardiac sarcoid or cardiac amyloid. So any heart muscle scarring can lead to ventricular tachycardia, whether it's from heart attack or from viral myocarditis.
So, what are the common treatments of VT?
So common treatments of ventricular tachycardia medications, we have multiple options of antiarrhythmic medications that we can use to suppress these episodes. For patients who are not responding well to medications and they still have breakthrough episodes despite high dose of these medications, we can do catheter-based treatment. Catheter-based treatment meaning that we access the heart or access the area where the scar is with a catheter, and we do 3D mapping inside the heart chamber. We identify the area where the scar is, and we identify the area where the source of this ventricular tachycardia. Then we cauterize that tissue to eliminate the circuit for the ventricular tachycardia. Implantable cardiac defibrillators, it's another option that obviously patients should get when they have history of ventricular tachycardia to prevent sudden cardiac death from these bad rhythms.
So what is the difference between a defibrillator, aka ICD, and a pacemaker?
This is a very good question. Defibrillator, it can function as a pacemaker as well as defibrillator. So the defibrillator delivers shock to basically reset the heart when you have bad rhythm or fatal rhythm, which is ventricular tachycardia or ventricular fibrillation. Pacemaker only treat slow heart rhythm. They don't deliver any shocks. So if we have patient with electrical heart block and slow heart rate, we give them a pacemaker if they don't have indication for defibrillation therapy, such as if they don't have any prior history of ventricular tachycardia or if their heart function is normal. So they end up with a pacemaker. If the patient, they have indication for having defibrillator, such as a prior history of ventricular tachycardia, or if they have history of low heart function, which basically meaning like ejection fraction of less than 35%, then they should get defibrillator, not only a pacemaker.
A pacemaker can be modified remotely. Is that correct?
That's another very important question. So they cannot be so we can basically interrogate the device. We can, let's say the patient is at home and they have a pacemaker. We can do remote interrogation. They don't have to come to clinic in person for device interrogation. But modification, meaning adjust the setting of the pacemaker or adjust the setting of the defibrillator, it cannot be done remotely. It has to be in person.
Interesting. Okay.
All right, so just help me summarize, doctor. I'm thinking about the questions I get in the pharmacy. You know, we have a lot of patients on heart medications, and we have patients that have pacemakers and defibrillators. Can you maybe give me and the lay public just a generality of why you'd get a pacemaker versus why you'd get a defibrillator?
Yeah, definitely. So pacemaker, you get a pacemaker if you have a slow heart rate or if you have heart pauses that can cause fatigue, dizziness, or even fainting. You get defibrillator if you have history of ventricular tachycardia, if you have history of, God forbid, prior cardiac arrest and survive the cardiac arrest, and like we notice that you have like ventricular fibrillation, or the EMS noticed that the patient had ventricular fibrillation or ventricular tachycardia when they had arrested, then they should get defibrillator. Now, if you notice, the symptoms can be similar. Fainting can happen from slow heart rate or can happen from very fast heart rate as well. So the symptoms can be similar, but the mechanism are different between both conditions. And we look at both. We look at the symptoms and we do diagnostic testing, and we find out whether the patient has slow heart rhythm that should get a pacemaker only, or if the patient has history of ventricular tachycardia or ventricular fibrillation that had led to sudden cardiac death, then they should get defibrillator.
All right, so this brings up some other questions that I've heard or read about. So a couple things to review based on devices. Any problems with a patient being around kitchen appliances like a microwave?
Yeah, I mean, that's a very good question. Patients always ask this question after I get a pacemaker or defibrillator, what should I do? What should I avoid? Now, most of these modern devices are well shielded and very safe to be around kitchen appliances. and household electronics. So they are safe. You don't have to avoid, for example, staying close to the microwave or like any household electronics.
Okay, what about can I still exercise?
You definitely can still exercise. We tell the patient after a few weeks from implanting the device, you can go back to normal. So you can exercise, you can run, you can do whatever you want. Actually, I advise the patient when you have a device, the reason that we give you the device so you can have normal life, so you can continue to live your life the way that you like.
Okay. 'Tis the bottom of the hour and time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
WHBC AM Canton. Reliable as ever. Powered by Friends and Family Credit Union. It's time to bring a friend into the family. On News Talk 1480 WHBC.
This is WHBC News. Good morning. I'm Pam Cook. Police have arrested a Summit County motel owner accused of interfering with an abduction investigation. Earlier this month, police were at the Office Motel searching for a woman who reportedly was being held against her will. They say the owner, Deepak Kumar Patel, withheld crucial information during the search and made it look like the woman was not at the motel. However, police later found her safe and took a man into custody. Meantime, Patel was arrested this week and now faces obstruction and tampering with records charges. A young girl believed to be between the ages of 10 and 13 died yesterday after being caught in an avalanche outside the boundaries of Brighton Ski Resort in Utah's Big Cottonwood Canyon. She was with two family members taking part in a backcountry recreation when the slide hit just before 1 in the afternoon. Rescuers found her buried in the snow, rushed her to the hospital in critical condition, but she did not survive. New Orleans quickly cleaning up after Carnival season wrapped up on Tuesday. Local hotels had reported 90% occupancy over Mardi Gras weekend. They say nearly 7 tons of material was recycled during the Carnival season, including 70,000 aluminum cans. In sports tonight on 1480 WHBC, we have boys high school basketball for you. It's Louisville at Jackson. Meanwhile, the men's hockey team plays in the Olympics at 3 o'clock this afternoon for the right to go for the gold on Sunday. I'm Pam Cook.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Out By store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy.
The Medicine Center pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Are you frustrated with the cost of prescription drugs? By now, you know that your insurance price isn't always the best price on your medication. The new Health Matters drug plan is a simple, easy way to save money at your local Medicine Center pharmacy. No need to visit GoodRx or Single Care, disclose your private information, or print out coupons. Just talk to one of our friendly staff members and ask for the best price. It is that easy. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia, and online at medshoprx.com.
This is Paul White from the Medicine Center Pharmacy. We have a fantastic deal for you just in time for flu season. Pick any 2 quality choice brand cough and cold items and get 50% off the lower priced item. Also, at the Half Off and Hot Buy store, we are all set for Valentine's and Easter. We're thinking ahead for warmer weather, so stop in and take advantage of these great deals. here at the Medicine Center Pharmacies and the Half Off and Not Buy store.
Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, midshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
Your severe weather station. News Talk 1480 WHBC.
Here's your AccuWeather forecast. Today will be windy with the low clouds giving way to some sunshine. We expect a high of 58 degrees, but temperatures will drop into the lower 40s. Tonight will be breezy in the evening, otherwise partly cloudy with a low of 30. Tomorrow will be cooler with intervals of sunshine and a high of 40. Tomorrow night, expect low clouds with a chance of light snow later on with little or no accumulation expected. The low will be around 30 degrees. With the AccuWeather forecast, I'm meteorologist Joe Lundberg for News Talk 1480 WHBC.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, we are talking with Dr. Taii.
All right, doctor, before the break, we were talking about some commonly asked questions about devices that you may be wearing or carrying around in you between defibrillators or pacemakers. So we talked about kitchen appliances and we talked about exercise. What about TSA screening and flying on an airplane? Any problems there?
No problems at all. Flying is completely safe. Airport security systems, they don't harm these devices. And as I was explaining that these devices are very well shielded. So definitely it's completely safe to fly. Now, what I tell the patients, always take, whenever they get a device, whether like a defibrillator or pacemaker, they get a card, a small card from the company about the vendor, basically the type of the device, the model, number of leads, the date of implant. So in case, for example, if let's say if they like stopped by and in the airport, well, they can show them this is the card, this is my device. I have this cardiac device whether a pacemaker or defibrillator. And it's also important to carry them around in case if there is, let's say, emergency. Let's say the patient traveled to a different city and they had to go to the emergency room for like any other reason, not cardiac reasons, and they have to carry their card with them. Make it easy for the provider to kind of like know the information about the device and the date of the implant.
All right. What about an MRI?
That's a very good question. Now, the devices these days are MRI compatible. Most of the new devices, whether pacemakers or defibrillators, I select check with the cardiology team because you might have a patient who had implant 20 years ago, and they had, for example, generator replacement, let's say 5 years ago. Now the generator is MRI compatible, but the leads were implanted 20 years ago might not become MRI compatible. So I always tell the patients, the devices these days are MRI compatible, but always check with your physician, check with your device clinic, get the information before you schedule your MRI.
Everything's so complicated anymore, isn't it? There's just so many moving parts.
True.
So,
yes.
Okay, so we talked about several things that I hear commonly. What are some things that patients need to be very conscious of, or maybe they should not do if they have a pacemaker or a defibrillator?
Now, we talked about the MRI. Now, when we said it's MRI compatible, we still have to make some adjustments with the software of the pacemaker or the defibrillator before they have their MRI. Why? Because these devices, yes, they are well shielded, but with strong magnetic field, you can have some interference with the function of the pacemaker or the function of the defibrillator. So as hardware, yes, the device is compatible, but we have to make some adjustment. So I tell the patient, avoid any strong magnetic fields because you might have interference between that magnetic field and between the device function. And if the patient, let's say they are dependent on the pacemaker because they have complete electrical block, When the pacemaker senses noise, outside noise from magnetic field, strong magnetic field, not simple magnetic field, the pacemaker might get inhibited. So the patient will obviously pass out because they are relying 100% on the pacemaker. Now, this is the most important advice I usually tell the patient. Some patients, I tell them, for example, avoid welding, or avoid, for example, coming close to a running motor for the same reason. Let's say a car motor while it's running, because you might have, let's say, while you're working, the device might get sensed. Well, there is some noise. This might come from the heart. Probably I don't need to pace, and that's when the device gets inhibited. That's when the fainting spell happens.
Okay, doctor, I have a couple questions that have come to mind as we've been talking, and I think we'd be remiss if we didn't have an explanation or some comments from you for the public about wearable devices and the things that have been going on in technology on the personal level. So, how reliable are wearable devices like an Apple Watch or a Fitbit in detecting arrhythmias such as AFib?
They are very, I mean, I usually tell the patient they are reliable. And if you have, like, if you have Fitbit, or if you have Apple Watch, or like any smartwatch that you can wear all the time, it will definitely help to detect this rhythm. The issue is usually the patient, they don't wear them all the time because it's not feasible. It's not like if you want to go sleep, you're not going to be able to wear your, for example, watch or Fitbit. But when you wear them, and if they have good contact, yes, it can give the information that we need. Actually, I've had multiple patients, they diagnose themselves with AFib with wearable devices. And when they come to the clinic, I ask them to show me, for example, the rhythm strip that they have on their phone. And it's AFib. Or, for example, it's clear like slow heart rate that might need a pacemaker because the patient had symptoms at the same time. I always tell the patient, we have to make clinical correlation between the symptoms and the time when they have the rhythm disorder. If the patient comes to me and tell me that they almost fainted, and they wearing, for example, a wearable device that can give me the information about the rhythm and the heart rate at that time, and I check the rhythm, for example, let's say, or the heart rate, and was in the 40s or 30s, and clear complete heart block at that time when they felt the symptoms. So there is clear, that means this is real. This is not just artifact. They are reliable, and we use them sometimes in the clinic to get more data before we make the clinical decision.
Would it be fair then to say, in a way, that a device like a wearable device could possibly be like a screening type asset or an early warning sign? And then definitely anything that's pointed out, patients should follow up with a provider or a doctor and make sure that they are checked out.
I agree with you. I think these wearable devices can be very helpful, and it can definitely help when if you feel something not right, and if you have wearable device, and if we can get the information or the data from that wearable device before we make the clinical judgment and before coming up with a plan, that would be great. And instead, so let's say if I have a patient I see in the clinic and they don't have wearable device, and let's say they come with fainting spells. So my first thing, obviously, getting EKG, 12 lead EKG in the clinic, asking the patient's question about this clinical scenario, how often, when did this happen? And if we can't reach into, let's say, if we don't know still, like we don't have information about the heart rate and the heart rhythm, my next step is to give them a monitor for 30 days they can wear. Compare if the patient already has wearable device, I don't have to wait for 30 days to get the information about their heart rate and heart rhythm. Say, I can get the information if they recorded the episode when they had the symptoms. So we can basically make the decision about our next step.
Earlier in the program, you mentioned, I believe, sleep apnea kind of in passing. Can you talk about what role sleep apnea may play in electrical heart disorders?
That's a very good question. So with sleep apnea, if you have patient with long history of sleep apnea, this will impact number one, the heart function, and number two, it will also affect the autonomic system, meaning the sympathetic and the parasympathetic system. These are the major innervations that supply the heart, and they can control the heart rate and the heart rhythm, obviously. So if you have bad sleep apnea that can lead to dilated heart or heart failure, then you obviously going to end up, whenever there is a scar, whenever there is damage to the heart tissue, there will be some sort of rhythm disorder associated with that. So that's number one. Number two is the autonomic system. Some patients, they have AFib because their heart rate goes very slow. At the same time, they have scar tissue in the upper chamber. This scar tissue becomes source of AFib. Now, if you have, on the other hand, if you have someone with very fast heart rate at baseline, when they have very active sympathetic system, this can also lead to rhythm disorder. Now, the sleep apnea, now you might, I mean, you might think as well, it's kind of like sleep disorder. Why would it affect the heart? It's actually, it affects everything. Now, if it affects the heart muscle, it puts some patient, they end up with right side heart failure because of the obviously the high pulmonary circulation resistance related to that. It can lead to rhythm disorder. And I explain to the patient sometimes the rhythm disorder in these scenarios kind of the tip of the iceberg. You feel the AFib, but the main problem probably related to very bad obstructive sleep apnea. I can treat your AFib, but we have to work also on fixing the sleep apnea by lifestyle modification or by using the CPAP machine.
It fascinates me that a CPAP machine can have such a cascade effect to control heart rhythm and things like that. It's really interesting. I guess it's probably beyond the scope today, but I don't know. That's really interesting what you just laid out. I've never really thought about it that way, so I appreciate that. I have a question about ablation.
Yeah.
Can you explain what that is and when it becomes right for a patient? Because you do that instead of drug therapy or some drug therapy, correct?
Correct. So the ablation, we do it sometimes as an adjunctive or can be an alternative to treat the rhythm instead of the drug therapy. Let's talk about, for example, AFib ablation. Let's say if we have patient who comes and they have episodes of atrial fibrillation that was, or they were detected by wearable devices or by 12-lead EKG. So I ask the patients a couple of questions. Number one, I ask, how active are you? And how bad the symptoms and how the symptoms affecting the lifestyle. Because sometimes you have patients that are very active, they feel the AFib and they start noticing a slowing or declining in functional capacity. Those patients, we try with them first cardioversion, trying some antiarrhythmic medications, and if they have side effect, or if, for example, the patient say like, well, I am taking too many medications, can we try ablation? So ablation is alternative. Sometimes actually first line of treatment if you have heart failure symptoms with atrial fibrillation. So the procedure basically is catheter-based treatment. We bring the patient from home, and it's obviously elective procedure. We put them under general anesthesia, and we access the femoral vein, sometimes one side, sometimes both sides, and we insert sheaths in that vein, and we after that insert catheter, and we go inside the heart with a catheter, and we map the upper chamber of the heart. We look at the signals with the map, obviously. We look at the EGM, we call it electrical signal from inside the heart chamber. And we identify the disease signal, which indicates there is a diseased tissue, and we cauterize that tissue. In the past, we used to have radiofrequency energy and cryo energy to freeze or to cauterize. These days, we have pulse field, which is a new technology that can deliver high voltage to the tissue in short period of time, and also cauterize that group of cells that they are acting as a source of AFib. So it's that basically it. the patient get the procedure done, and they leave the next morning. So it's kind of like overnight stay.
Okay, Brad, I think our final break is here. Am I correct?
Yep.
Okay. You're listening to Health Matters with the Medicine Center Pharmacy. We will be back in a moment.
Are you frustrated with the cost of prescription drugs? By now you know that your insurance price isn't always the best price on your medication. The new Health Matters Drug Savings Plan is simple, easy way to save money at your local Medicine Center Pharmacy. No need to visit a website or disclose your private information, fumble with your smartphone, or print out coupons. Just talk to one of our friendly staff members and ask for the best price. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia, and online at medshoprx.com.
This is Paul White from the Medicine Center Pharmacy. We have a fantastic deal for you just in time for flu season. Pick any 2 quality choice brand cough and cold items and get 50% off the lower priced item. Also, at the Half Off and Hot Buy store, we are all set for Valentine's and Easter. We're thinking ahead for warmer weather, so stop in and take advantage of these great deals here at the Medicine Center Pharmacies and the Half Off and Hot Buy store.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Hot Buy store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy.
The Medicine Center Pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, medshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
1480 WHBC.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thank you for joining us. Let's get back to the last segment of the show. We are talking with Dr. Taii from Altman today. Doctor, I'm going to ask you a question. You ready?
Yes. Yeah.
I'm watching the Olympics. You know, all these guys are upside down and doing flippy doos in the air and just about standing on their head. What happens to their heart?
So every time, I mean, obviously they are like well-trained athletes. So athletes usually they have lower resting heart rate compared to someone who is not very active. Their heart rate can go up to support their level of activity, but is not going to be, let's say if you have someone who's not very active or deconditioned and you ask them to do simple activity, you're going to see their heart rate jump up to 180, 160 with sinus rhythm. So the rhythm is normal, but the rate is fast compared to someone who's very well trained. Their heart is very well conditioned to do some sort of athletic activity. You see their resting heart rate probably like when they're sitting doing nothing in the 40s. And again, it's sinus rhythm. And when they do some sort of activity, it goes up to 120, 130. So you will see that they start with lower heart rate. And when they move and do things, it's going to go fast, but it's not going to be as fast as someone who is deconditioned because their heart is already trained compared to someone who is not very active. Now, their pump function, their heart muscle is also thicker than someone. Now, sometimes patients who are like deconditioned or they're not very active, they have condition to make their heart thicker. But for the athlete, obviously, when they exercise, they have thicker heart muscle compared to someone who is not very active. So definitely there is difference between athlete heart and between hearts who are not trained or not well conditioned.
Interesting.
All right.
Just,
How about are there some other situations? I think that in the spirit of our conversation this morning, we're probably talking about patients that as they age, they may develop AFib or VT or whatnot. But there's some reversible causes, aren't there? Like if maybe someone's like really dehydrated, or maybe if they're low on electrolytes, or maybe they're consuming too much caffeine. Are some of these things contributors to electrical problems?
That's very good question. Correct. So these things that can also contribute to rhythm condition, especially, for example, heavy caffeine intake or dehydration as well. Now, there is difference between what trigger the episode and what maintains the rhythm disorder. So if you have a substrate that can lead to rhythm disorder, that means there is something wrong with the heart tissue. Now, what triggered the event might be electrolyte disturbance, might be dehydration, might be like higher caffeine intake on that day or excessive alcohol intake that can lead to this tissue to become active and become a substrate for the rhythm disorder, whether it's atrial fibrillation or ventricular tachycardia or supraventricular tachycardia.
how about anything else you want to share with our listeners?
If something does not feel correct and you don't feel like, for example, this is not your normal day, please don't ignore it. If you feel something unusual in your chest, if you have chest tightness, some palpitation, or any episode of dizziness, try to seek early evaluation so we can identify the problem early and fix the problem. My other advice, which is more important, try to take care of yourself, take care of your health. Lifestyle modification is very, very important. We can fix the rhythm. We can, for example, my colleague can fix a heart attack, open the artery, but this doesn't mean that you're going to be, let's say, protected in the future. This is not a clean health bill. If you, for example, if you notice that you have sleep apnea, try to treat that. Don't ignore it. If someone tells you you snore at night, or for example, you stop breathing sometimes, please don't ignore it. Seek medical attention.
So, what Altman location do you practice at?
I practice in the main Altman Hospital in Canton. My clinic is in the Bedford building, and we have cath labs and we have electrophysiology labs in the same building. It's in Canton.
Mm-hmm. So how can our listeners contact you or find more information about your practice?
It's on the website of the cardiovascular consultant group, and it's very easy. Like we can accommodate for patients, for example, to be seen the same day if they have any problem. As I mentioned, we are a big group of cardiologists, including interventional and electrophysiologists as well. We can definitely accommodate for the patient if they have any sort of emergency to see them the same day or within a couple of days. Obviously, the ER is always available, but the office also, we can see them as soon as possible.
Interesting. What else do you have, Brad?
Generally, you necessarily don't need a referral to see a cardiologist as you're leading up to, but you're probably going to you should be seeing your regular physician, right?
Correct.
But they can refer to you guys if there's
Correct.
a need that the patient discusses with their doctor, right?
Yes, yeah. I've seen patients, for example, in my office who were referred by my colleague, by general cardiologist or by interventional cardiologist. Also, I've seen patients who were referred by my colleague primary care provider, internal medicine or family medicine. They see the patient and they basically, the patient asks them for like a referral for, let's say, if they have heart rhythm disorder in the past, or they have palpitation, or they have fainting spell, they send them directly to us.
Okay, we're about out of time, aren't we, Brad?
Yep.
Okay, thank you to our guest, Dr. Taii. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to Altman Health System and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here again next Friday on News Talk 1480